Good evening and good morning for those in the Americas. My name is Tiziano Cameroni and I'm joint owner in professional dietetics. Just a quick introduction of the company and then I will leave the space to Dr. Fassola and to talk about this new upcoming product. So Professional Dietetics is an Italian pharmaceutical company founded in 1996 and specialized on amino acid formula for medical use. We have two lines of research. The first line is the one related to mitochondrial disease, where we are developing clinical nutrition, while the second area of research is the one related to tissue regeneration, where we are focusing on the fibroblast and where we are developing medical devices composed by hyaluronic acid and patented formula of amino acids. We are in many areas of the pharma environment, and we are in clinical nutrition for metabolic disease, as we said before. Then in tissue regeneration, we are in wound care, we are in cancer supportive care, we are in oral surgery, we are in aesthetic medicine as well, because when you know how to repair the tissue of a patient, a sick patient, then it is even easier to repair the tissue of an healthy patient. And we are also in gynecology. Gynecology is the topic we are gonna talk today. And I would leave now the space to Dottoressa Fassola to introduce herself and to talk about the product.
Thank you, Tiziano. Good evening, everyone. I'm Elena Fassola from Milano, Italy. Here I have a clinic focused on aesthetic medicine, plastic surgery, and aesthetic and functional gynecology. But I'm also a general secretary of my association, founder and general secretary of IGEF, that is Italian Association of Aesthetic and Functional Gynecology. I'm going to share my screen with presentation. Okay. And open. Okay. And open my presentation on our IntiCare. IntiCare is a product indicated for the treatment of vulvo-vaginal atrophy, specifically and primarily for vestibular area of vulva, vaginal introitus, and part of vaginal walls, but also for labia majore. Inside the box, we can find enough product to do two entire treatment for two patients, because inside the box we have in total 6 ml of product, 3 ml per treatment. So we can find 2 vials of 3 ml of not cross-linked hyaluronic acid, low molecular weight hyaluronic acid, and 2 bottles of 100 milligram of amino acid, specifically glycine and left-handed formula of proline, lysine, leucine, valine, and alanine. Sorry. Okay. Indication of IntiCare. We can dedicate the primary indication is for the main symptoms of atrophy at this specific area of our body that caused by aging in particular, and in proximity of menopausal age, the main symptoms of atrophy, as you know perfectly, are dryness, itching, burning, and dyspareunia. In particular, dyspareunia is localized most of the time in introit of vagina. We can use IntiCare in all races with vulvo-vaginal atrophy and related symptom. We can include patients in HRT, hormone replacement treatment, or food supplements also by hormone mimetic treatment, but also in another age, important other age in which the women feel discomfort is, of course, in period of postpartum. For example, we can treat episiotomy scars, but the primary indication is, of course, atrophy related to climacteric age, menopausal age, and postmenopausal age. Why we start to treat the vulvo-vaginal area at the level of introitus of vagina? Because exactly the main symptoms start here, specifically in this district, in this anatomical area. As you know, compared with the depth dyspareunia, the dyspareunia of introitus is one of the most symptoms related to aging. And then vestibular area, we have to take in serious consideration art lines, that is a line that anatomically, or better histologically, divided two different kind of tissues, as you know, derms and mucosa. Why I why I underline this concept? Because the answer of this treatment, but also for other treatment, is different because are different these two different tissues. Okay. What's happened when we are in perimenopausal age or in front to the atrophy of vulvo-vaginal area? Histologically, we have a progressive hypertrophy of derms and mucosa for deficient estrogenic stimulus on fibroblast, with flattening of the dermoepidermal junction first, dryness, loss of elasticity, laxity, fragility with related dyspareunia, thinning of the mucous membrane with easy to microabrasions, and inflammation with dyspareunia and related dryness and itching. But what's happened also macroscopically? This is a specific case of vulvar area in a patient of 47 years old, in which we can see perfectly a lipoatrophy with consequent reduction of the volume of both labia majora associated and associated dermatocalasis. We can treat with IntiCare the volume of labia majora because it's not cross-linked product, but is a true heterologous bioregenerating approach for improve the quality of derms or of dermis. We can improve the microcirculation thanks to its anti-inflammatory and antioxidant functions. So these last concepts are inside the aims of the use of IntiCare, okay? Because thanks to IntiCare, we can stimulate collagen, specifically collagen type 4, collagen type 7, but also collagen type 1, and elastin, a very good quality of elastin, a new elastin. We can reduce our hyaluronic acid depletion. That is important when we are using a injectable hyaluronic acid. And we can stimulate fibroblasts proliferation and, of course, their activity. In one word, we promote the extracellular matrix remodeling. Contraindication of IntiCare, but actually we can consider this relative and absolute contraindication for all product hyaluronic acid based and injectable in this area. Among the absolute one, we have to take in consideration patients with medical history of anaphylaxis or with severe polyallergic diathesis. Not because inside there is hyaluronic acid, but of course if you have patients with this medical history, of course they have a contraindication for all treatments, actually, okay? Then we have to take in consideration also the major autoimmune diseases of the soft tissue, like I'm referring to systemic lupus erythematosus, rheumatoid arthritis, systemic sclerosis, autoimmune myositis, eosinophilic fasciitis, very important disease in which in these patients is not normal use everything, okay? Also devices, energy-based devices, for example. Among absolute contraindication, we can find also untreated or uncompensated diabetes, ongoing oncological diseases, patients on chronic corticosteroids therapy. Often this 5 point is related, of course, to point 1 and point 2. Among the relatives one, we have to think to the patients with ongoing treatment for damaged skin or mucosa in the same area of the treatment, of course, ongoing anticoagulant, anti-inflammatory therapy, ongoing corticosteroid therapy, ongoing infection or inflammatory disease in the same area of the treatment or affecting genitourinary simplex like herpes simplex or zoster R, bacterial infection, mycosis, and cystitis. Of course, we have primarily to cure these specific diseases, and then we can go with treatment with IntiCare easily, okay? Then there is a specific topic of lichen sclerosus. That is a important autoimmune disease, but often is localized in genital area, female genital area, also in male genital area, but the topic is female genital area. Is a precancerous disease. For this reason, depending on the stage of the disease, because if we have a lichen sclerosus treated and compensated with corticosteroid therapy, of course, during the period in which the woman can stop the corticosteroid therapy, we can use IntiCare. But I suggest you to start to use IntiCare because it is specifically indicated in patients just with vulvo-vaginal atrophy. Mechanism of action. Thanks to low molecular weight hyaluronic acid added to this specific patented formula of 6 amino acids and their interaction with fibroblast receptors, specifically for low molecular weight hyaluronic acid, we can have a very high overexpression of collagen 4, that is a collagen called of anchor plaque, because is a specific structure that take together a collagen type 7, that is fibrils of anchoring fibrils, and together take fixed at the better way other fibers of collagen type 1 and type 3. There is, of course, beyond the expression of gene expression of collagen 4, 7, and 1, of course, we can stimulate the new elastogenesis with a very good molecules of elastin. In this case, the results is reconstruction of extracellular matrix and hydration, antioxidant tissue response. In one phrase, we have a skin and mucosa restructuring. Another important concept and is that thanks to the injection of IntiCare, we can counteract the hyaluronic acid degradation, physiological hyaluronic acid degradation by enzymatic action caused by hyaluronidase of about 40%. This is a very interesting study in vitro. Sorry, I have to move the platform of Zoom because impact on my screen. Okay, this is a very interesting trial and very interesting article of Laura Tedesco on in vitro on human fibroblast. And then other two important trial on IntiCare, in which we can see that after 120 hours after low molecular weight hyaluronic acid added to our 6 amino acid injection, we have a very great protein expression in collagen plus elastin, and a very high hydration that is last for 6 months, deep and superficial skin hydration. In which way we can use IntiCare? What is the injection protocol? We consider the right protocol in 3 sections of injection. 1 injection every 14-21 days. I prefer 1 every 21 days because it is a specific time in which we have a right stimulation of collagen, new collagen for 7 and 1, and of course elastin, and we have the first ACM remodeling. So I prefer 21 days, but it's okay also every 14 days. The range is between 14 and 21 days if you have difficulty to see the patients in other day of the week, okay? Not less 14 days, not more 21 days. Where the anatomical area in which we have to inject IntiCare are vestibule of vulva, introitus of vagina, and the first 2 centimeters in caudocranial direction of vaginal walls, and of course both labia majora. We have in a few words 3 steps technique into vestibular area of vulva. We can inject IntiCare by a needle of 4 millimeters and 30-32 gauge. Of course, the deepness, the depth, sorry, of injection is not 4 millimeters, but about 1-2 millimeters. The injection techniques is microbolus, by macrobolus, multi-macrobolus, or this technique is called also nappage technique. Into the vestibular area, we have to perform 10 points of injection, about 0.03 ml per point, and the total amount of injected is about 0.30 ml. In introitus, I don't know where is the video, sorry. Okay, is in the slide, in the next slide. In the introitus, we have to perform the injection in 3 segments, but the technique is not different compared with the other technique before illustrated. But the total amount in introitus of a vaginal and vaginal wall are 0.90 ml. And then we have the injection in labia majore, but I will show you in the next slide. So to be clearer in the explanation, this is a schematic transversal section of vagina. Often in Europe we use, but I think is in other parts of the world also, I think we use a schematic watch, no? We have to inject the vaginal wall from 1 to 4, for 4 to 8, and for 8 to 11. For each segment of this transversal section, we have to inject 10 points here, 10 points here, and 10 points here, with a volume per points of about 0.002 to 0.003 ml, and with total inside the vaginal walls of 0.9 ml. Also in this, even in this area, we have to respect the depth of 2 millimeters. I repeat, for 2 centimeter up to 2 centimeter in a caudocranial direction. In the video, I'm injecting the vestibular area and part of posterior commissure of vulva with the 10 points of injection, and then thanks the use of speculum, I am injecting 10 points here, 10 points here, and 10 points here. The technique on labia majora is simple, is easy, like the technique used before, but is a little bit different because, of course, we have to treat derms of labia majora. So we can use a needle of 13 millimeters and 32 gauge with a subcutaneous fan technique, fan shape technique. For each point, we have to use about 0.3 ml per point and about 0.9 ml per side, total of 1.8 ml for both labia majore. Sorry, I have to leave just for a moment from presentation because I have to open a other video that is incredibly heavy, and so I have to open it in another part of ok. Con un training. This is a patient treated during live surgery of Age of Congress, concluded 2 days ago. And as you can see well in this video, I'm injecting with 13 millimeters needle and 30 in this case, but I prefer use 32 needle, just in subcutaneous layer of tissues, and then with a injection that is similar to a fan, no? Is a fan shape technique. We are injecting IntiCare. Of course, depending on the vulvar area, the dimension of the vulvar area, sometimes I inject in 2 points per labia or in 3 points per labia. The most important thing is to inject the entire amount of product. So, but is incredible easy, this technique. I'm going quickly to the presentation another time. Okay, so this is a product highly studied during the years, first of all, but in the last year we are conducting an important prospective semi-randomized international multicenter clinical trial on 80 patients with all races included. At the moment, we achieved just one dropout, one patient in dropout, with age range of from 46 to 60 years old, all affected with vulvo-vaginal atrophy and related symptoms, in 4 groups, 20 patients for center. Primary endpoints are safety and efficacy, and other endpoints are, of course, tolerability of treatments, improvement of QOL. That is important because we are injecting this specific product IntiCare for this reason, to improve the quality of life of women. We used also another investigating methodology, that is a vaginal maturation index, to have the result also thanks to cytological improvement on maturation cells of vagina. And of course, another important concept is the improvement of sexual life. In this case, we used another questionnaire called satisfaction with sexual life scales, and with the same, precisely the same technique that I showed you before, and in the same area, introitus of vagina, vestibule, first 2 centimeters of vaginal walls in crowd-carnal direction, and labia majora, both labia majora. Per section, for 3 sessions of injection, of course, and we achieved results on at 3 months and 6 months. We are concluding just in these days the 6 month of this clinical study. So I can show you the preliminary results on 40 patients at 3 months, because I complete these 40 patients and I have all results on them at 3 months. And first of all, we have to consider the first endpoints, that is safety and efficacy of 40 patients. Of 80 patients, we have just 19 patients presented only very slight and transient burning and or swelling sensation, which disappeared spontaneously after about 1 hour. Of course, is caused by injection, no? It's normal. Just one patient suspended the study because she felt too tight to complete the study. No other adverse events we achieved in this study, and this is a data incredibly important. Is very well tolerated by patients, because the main score on thanks to the 5 points Likert scale, that is a measurement of tolerability, is 3.9, that is here. Is a very great results on tolerability. VAS score, that the score for discuss on results on the main symptoms, that is a reason, no? For which we use IntiCare, improvement on improvement of symptoms and improvement of quality of life and sexual life. So we achieved a very great results, mainly on dyspareunia and dryness, that of the first main symptoms, these two are the main distressing symptoms for patients. And then the improvement of quality of life, thanks to the satisfaction with sexual life, in 3 months was from 4.1 to 7.7 in a scale from 0 to 10, from worse to better. And also the cytological results, that is a quantity of maturations cells of vaginal mucosa, for example, in a patient of 59 years old, 59 years old patients, from at the basal time, she was at 43%, and after 3 months at 58%. I think the results are very interesting. Thank you. Any question?
Elena. I think we can now leave the space to questions.
Okay?
Okay, so okay.
Ciao Zalfa, Al-Musawi.
So it seems you know her, okay?
Is the treatment not painful? No, it's painful because, of course, is an injectable treatment. So we have to use before an anesthetical cream. We can use it about 30 minutes before in a mucosal area. But it's better to use injectable, is easier to use injectable lidocaine when you want to treat also labia majora, because this is derms is and in this district an anesthetical cream is not so powerful like in a mucosa in a mucosal area of the vestibule or not vestibule, sorry, the introital of vagina. The treatment of liquor sclerosis is forever, is not indicated. Stop. Questa non l'ho capita. Tu l'hai capita, spettatore?
No, non la capisco neanche. So it's not clear the question related to lichen sclerosis. Please, can you write it better? Okay.
Do you ever use a small cannula? Is not indicated the cannula here because I won't use a needle to have also a mechanical mechanotransduction thanks the use of needle, because as you know perfectly, using needle, you stress the skin and you can give another important stimulus on fibroblast motility. And for this reason is better and is useful use needle. How long does treatment last? How long does treatment?
The results are lasting, I think. How long are lasting results?
Result or how many time you have to use to treat the patients?
You can say both.
If is regarding the results, we have great results for that lasts 6 months. Then you have to repeat the entire protocol if we are treating a patient with a severe vulvo-vaginal atrophy. If you have to treat a patient in climacteric age, for example, in pre-menopausal age, for example, for patient of 45 years old, not in menopause, of course, maybe she hasn't a severe sign and symptoms related to aging, because she has enough estrogen level, circulating level of estrogen, and so we can treat, for example, a case like that 3 times with entire protocol, and then with medical examination after 6 months, decide if it's better to treat another time, but not for 3 times. Okay, I don't know if I'm clear. Non so se sono stata chiara, Tiziana.
Let's say that so I try to summarize. So the protocol is the 3 session, and then again after 6 months you should evaluate, so a medical inspection, and then you decide probably you just need 1 session and not 3 sessions.
Entire protocol.
Yes.
Exactly.
Okay.
Is the injection technique similar to a G-point injection? But no, because we are in totally different area of treatment, or better. G-point injection is in just 1 point, around of G-point, that is in anterior wall of vaginal, very close to the urethra, and for this reason is not similar. Perché non si può fare il liquen in... Sì, questo è regenerativa. Ah, è dallo spagnolo. Ciao Andrea Casella. No, you can treat lichen sclerosis, but we haven't enough results on lichen sclerosis. For this reason, of course, we can treat, but it's not at the moment the first indication. At the moment, the first indication is vulvo-vaginal atrophy in a healthy patient. Why would it be contraindicated in lichen? For that reason. And then depending on the stage of the lichen. How often procedure must be repeated? Every 6 months. Paolina, ciao. Ok. Maria José Araio, dove sei? Would it be contraindicating in lichen? No.
Okay, it's not contraindicated.
It's not contraindicated, but it is because we haven't enough results on lichen at the moment, but we are studying also.
Yeah, we don't have data enough, but this is what...
data, no results, exactly, data. Thank you for presentation. So for lichen sclerosis, we cannot treatment with Sunekos IntiCare. Lichen is a hot topic, but we can stay on that when we will have enough data.
Okay, then there is another question that is, on which day postpartum can we inject?
Scusami che stavo leggendo un'altra cosa, ero distratta. Cosa?
On which day postpartum can we start injecting?
Okay, depending on the childbirth, first of all, because often we can use IntiCare to treat a episiotomy scars, so we have to attend almost 3 months after childbirth, natural childbirth. I prefer attend about 3 months. Ah, grazie Andrea, scusa. Monica Sibul, thank you for your presentation. Thanks for coming, Monica. Okay. Ciao Ursula. In women with iatrogenic menopause due to treatment for breast cancer, do you also repeat after 6 months to entire protocol, or is it one injection? Yes, we have to repeat after 6 months the entire protocol, because often in breast cancer survivors patients, as you know, Ursula, the vulvo-vaginal atrophy and related symptoms, of course, I think are severe, and so it's better to treat with entire protocol every 6 months.
So there is a feedback from a doctor you met when in IMCAS. I see Maria Jose is saying, I used the protocol on vulval fissure caused by lichen with very good results.
Fantastic. Okay. When we will have enough data, we can say, okay, go on and treat lichen sclerosis with this data and with the results. At the moment, the indication is for vulvo-vaginal atrophy.
Correct. Qua c'era, thank you for the presentation. What kind of anesthetic, of antiseptic are you using to disinfect the mucosa?
You can use a normal antiseptic liquid. There is not a specific one, because mucosa is not so difficult to have a very great antiseptic situation, because condition. So you can use the same antiseptic liquid, that product that you use for skin.
Okay, then
Jasna, ciao. It's possible to use it like a servo. Jasna, then send me your telephone number, because I want the picture of IGF Congress with you. Sorry for... It's Jasna, dov'è?
L'ho messa come risposta.
Ok, dimmi cosa c'era scritto.
Con CO2, sorry, can you please, ok, risposta fornita, I'm checking. Allora, era, is it possible to use it like serum, not injecting after CO2 fractionized laser as LADD?
Serum?
Sì, in pratica chiede se lo può usare solo come crema invece di iniettarlo, ma non è il suo scopo.
No, is not. It's better. Jasna, it's better to use by injection, because it's important to put in a precise layer of the tissue with mechanotransduction also by needle, and is an injectable product. It's not for for example, radioporation of topical treatment is injectable, so you have to use needles, but is incredible easy. The technique is not difficult.
Okay.
And then the combo with laser and light device, light based. I don't remember the question, Tiziano.
Allora fammi andare indietro che te lo dico.
I have to check in
as
the
LADD. LADD.
Yes, you can. Yes, you can use with energy-based devices in general, but you have to stay in this specific protocol. For example, one of or better, if you today treat the patients with laser, you have to treat with IntiCare after 2 weeks. And then after 2 weeks again, another time laser. Every 2 weeks you can use laser and IntiCare
Alternating.
alternatively.
Okay, then there are 2 questions related to labia majora. So the first is, can I inject it for aesthetic purpose in labia majora?
Yes, you can, but not to improve, for augmentation of volume, for volume augmentation, because it's not cross-linked the hyaluronic acid. You can't use it for change the shape of labia majora, but you can improve highly, greatly improve the quality of the skin, because you have improvement, a high improvement on microcirculation of the tissue, thanks to the antioxidative and anti-inflammatory action of this product. So with IntiCare you can achieve a very important improvement in quality of the skin. That is not less, is important result also. You can't change the shape of labia majora because it's not cross-linked the hyaluronic acid.
I think you answered both the question in this way. Okay. Does the discoloration of the skin in the vulva major improve in menopausal patient after the treatment?
Ripeti che stavo leggendo anch'io, scusami Tiziano.
Does the discoloration of the skin in the vulva major improve in menopausal patients after the treatment?
Yes, improve even hyperpigmentation, because if you had the opportunity to read a very interesting article by a colleague from ricordami il nome, Tiziano, cavoli, dalla Romania, sulle ipercromie del volto. I don't remember the name in this moment, but with the kind colleagues from
Quello sul volto?
Sì.
Dalla Polonia.
Da Polonia. Colleague from Poland. Sorry, I'm a little bit tired after IJER Congress. I don't remember the name of my friends and colleague from Poland. Sorry. So with her, we studied also even hyperpigmentation, but on the face. But in my experience, we can achieve interesting results, or even for hyperchromy of hyperpigmentation of labia majore. And then there is another interesting and important study by a colleague from Iran.
Yes.
In of course in her country, hyperpigmentation is a problem for women, of course, because a lot of person are with high Fitzpatrick's level of skin, and we can improve in very well the hyperpigmentation in labia majora area.
Okay. Now there are 2 questions related to some particular kind of patient. The first question is, what about patient with breast cancer history? I mean, probably because of the hormonal therapy they are undergoing, and this is one of the issues that then is generating the dryness.
Aspetta che di nuovo ero disattenta, scusami. Mi fai vedere dov'è la domanda? La posso leggere anch'io?
Sì. For the patient with breast cancer history.
Sai che non la vedo.
È la prima in alto adesso.
Ah, for the patient with breast cancer history. Yes, you can treat them, but you have to be sure that there are out of the disease, or better, out of the diseases, we can say that when the patient stay well for 5 years. But of course, if you have a patient in aromatase inhibitors treatment, we can use IntiCare after 2 years of aromatase inhibitor treatment. It's clear? It's clear, Zalfa, Al-Musawi? Vediamo. No. È chiaro, Tiziano, sì. Tiziano? Tiziano? Non vi sento più.
Eccomi, scusami, ho avuto un...
Ah.
Ok, ci sono qua. So, ok, what about patient after radiotherapy? Okay.
We can use IntiCare.
Okay.
After radiotherapy, where?
I think it was still related to the same question before. Si può fare, so can you do it after CO2 laser as a combined treatment, physical, biological? Okay.
Yes, it's the same question of before.
Then again, someone is saying if it is possible to use it as a topical after the laser. I mean, you are losing a big part of the efficacy if you're using it topical. I mean,
it's a pity to use so useful procedure and product just with a topical treatment. Is a pity. Why? Is injectable, is a very sophisticated product, very helpful, and so it's a pity to
to reduce the efficacy. Yeah. Okay.
Reduce efficacy and is not its use, no?
I am grateful for the opportunity to facilitate in this webinar.
I prefer don't inject labia minora, sorry. If there are also markedly atrophic, isn't it appropriate? In which case, chi era questa? Non me la sparare subito nelle risposte.
No, davanti a te, ho tolto quella sopra.
Ah, dov'è? Scusammi. Ah, scusa, ok. No, perché vedo cambiare, scusa, Tiziano. Dalva, why you want to inject labia minora? In which cases you have hypertrophy of labia minora at 100 years old? the symptoms all starts at the level of vestibule, of vulva, at the level of introito of vagina, and we have a lot of skin to be treated at the level of labia majora, labia minora, with age, worse their hypertrophy often. We have an involution with atrophy of labia minora, but in late third age. I think in late third age, the last problem that the woman can have is symptoms at the level of vagina. Of course, there are also symptoms in very old age at this level, but is impossible to think to treat a very old woman like this case is with IntiCare. We have to treat with a drug, a serious drug therapy, with drug, not with other things. The area. Elena, thank you very much for a very good presentation. The patients would take a contraceptive pill, have dyspareunia, of course. Do you have experience with young people? Yes, very interesting. Neziha Chenjik. I hope to pronounce your name well. Very important and interesting question is this, because with contraceptive therapy in young women, we have often vaginal atrophy with dyspareunia because caused by hormone, in this case, too much hormone, no? Not normal level of hormone, because it's not physiological to have so many this quantity of hormone in circulation. For this reason, is the first cause of dyspareunia in a young woman. I have experience, and the results are very similar. So you can use IntiCare for this problem. That is a serious problem in young people. Radiotherapy in vaginal area due to cervical or endometrial cancer. Have you any experience in this kind of patient? Yes, but it's better, like in the slide in which I showed you the contraindication. It's better to be sure that the major oncological disease is finished. For this reason, you can treat the area after radiotherapy, but not just after, okay? You have to be sure that the patient is after 1 year, for example, if radiotherapy in vaginal area was in vaginal area, mostly in lichen sclerosis, CADSIS. Non ho capito. Tu hai capito, Tiziano, questa domanda?
No, penso che I think the question related to lichen is the same as before. So there are no counterindication, but so far we didn't perform any proper trial to validate a proper protocol and everything. It will be probably next step.
in the patient is taking a small dose of aspirins. Thank you. Yes, a small dose of aspirin, yes, but this is small dose of aspirin. Maybe the problem is not important. So you can ask to your patients to stop for 2-3 days to take aspirin.
Okay. Then in case of vaginismus?
Yes, why not? Of course, you can't improve vaginismus because vaginismus is totally another disease, no? Because it's a spasmus of some muscles inside the vagina and pelvic floor. So for this reason, we can treat with IntiCare vaginismus, of course. But if you have patients with vaginismus and vulvo-vaginal atrophy, why not? Of course.
Perfect. I think we have finished. Thank you. Thank you, Elena. Thank you, Dr. Fassola. Sorry.
Oh, it's the same. Elena
Come
is
on.
my first name.
I know. I've tried to avoid to call you Elena.
But it is true that Fassola is the name of my father, my lovely father.
Okay, so
okay.
Thank you for joining us this evening, and you will be contacted soon by your local distributor to get more information. Have a nice evening. Bye.
Ciao, thank you. Ciao, ciao, bye bye.